Have you been told you've got a meniscal tear? Well, if you have, this video is for you. Oftentimes people think when they hear I have a meniscal tear that it won't heal. All right, I'm here to show you how to get yourself healed and repair that meniscus tear. Hi, I'm Tom Dalonzo-Baker. I'm a physical therapist from Raleigh, North Carolina. And since 2001, I have been showing people how treating other areas of the body besides the injured area can get you oftentimes immediate relief and longer lasting relief. And let me just go right into this and show you how to do it. And then we'll explain it later. So the first thing is, a lot of times people who have meniscal pain, they'll tell you that when they go to wash their feet in the shower, it really hurts. They can't do it. In other words, one just doesn't want to lift up, okay? The other thing is perhaps when they go to put their feet up like this, because what you're doing is you're adding torsion to the knee, and that's painful. So anything, or maybe they're standing and they go to step down off of something. So that rotational component often is the thing that really elevates their pain. So what I want you to do is I want you to go find the motion and test it left side versus right side and find something that hurts it. Now, some of you may say, well, it hurts just sitting here. Well, I need a motion that then increases it. And I need you to do that exact same motion on the other side and see what it feels like. For example, going up like this versus this. Maybe you'll find out just simply doing a nice straight leg raise bugs you. Now, I want you to know that you can lean back. I don't want you sitting up tall. It's not a natural motion, all right? It'll restrict your movements. So let yourself slouch some. As long as your thighs getting closer to your chest, you're okay. But most of the time, it requires a rotation component. So if you want to do like a one-legged sit to stand with your foot turned in and foot turned in or out, and compare it to the other side. So that's rotated in. Now I'm going to compare it to this side, rotated in. Yeah, it's harder, but I'm not getting pain. And you may not feel pain. You may just notice there's a difference left side versus right side. Right now, we're going to start there. We're simply going to start, find the thing in your legs that bother it. Now what I want you to do is I want you to score it. It's very simple. Most of the time people use, or clinicians use a scale of 1 to 10. We need bigger numbers. We want you to use from 10 to 100. So if I said to you, hey, how much yuck when you do that motion is there? 10, 20, or 30 is a low. 40, 50, or 60 is a high. 70, 80, 90, or 100, sorry, let me take that back. 10, 20, or 30 is a low. 40, 50, 60 is a medium, and 70, 80, 90, and 100 is a high. And I say to you, how yucky is that? Don't overthink it. Just get a number that we can start with, that we can try to lower to 0, and 0 means no pain. So, once you find it, score it. Write it down on a sheet of paper or something. That's your starting point. Now, we're going to go and make sure that, like, for example, when I do this motion, it's smooth and easy, okay? Maybe when you do this motion on the other side, it's just harder. And let's just say I call that a 50. Okay, that's my start point. All you want to do now, let's just say this is my problem. Or maybe standing up and trying to do it is my problem. And you say, oh yeah, that's definitely a 70. All I want you to do now is I want you to do 2 sets of maybe 15 to 20. Maybe you're deconditioned and you can't do that many. And I want you to make sure that the good side feels normal-ish. If they both hurt, you're not going to do this exercise. You're going to wait until we go to other parts of the body, because we need to treat legs, trunk, and arms. Right? And you may find that you get more improvement by treating the trunk, or maybe even treating the arms. So just going to go through. I'm going to do 2 sets of, so we got a little bit of So now you may not feel it. You may feel restriction, not pain. That's okay. Just do 2 sets. All right. I'm going to abbreviate this just for the video. Okay. I'm going to do 2 sets of 15. How long do you rest in between? You rest as long as, or you rest until you're ready to do it again. Some people are 15 seconds, 30 seconds, a minute. Depends on how conditioned or deconditioned you are. When you're ready, you do another set. Now really get to end range, okay? Really pump it up there. Now, if this were my good side sit to stand, then I would go and do these. Whatever motion you found that bugged it, you do the opposite side if that side feels good. All right, so I do it. And this one I'm just going to do, I don't even know what number I'm on. Just going to, enough. And again, don't switch between exercises. I did just to show you what a sit to stand would look like. Now, you're going to recheck the opposite. Let's just say I've been doing these. I'm going to recheck this. And it was a 50. Let's say that's what I called it. Now we want to head to 0, okay? So with that said, you're going to check it out, and you're going to say, on my bad side, whoa, went from a 50 down to a 30. Awesome, that means it worked. And what you're going to do is if it worked, you're going to do it again. All right? 2 more sets of 15 to 20 to 12, 15, 20, whatever is a decent amount. All right, you go, yep, I feel like I can do that. You get 15 in, you go, that feels about right. Basically what I tell people is, I want you to do enough that you say, I've done enough, but I'm not like, I don't want to not do another set. Because if you don't want to do another set, you've kind of done, you did too many on that one, okay? So we're going to do another 2 sets. Go ahead and do another 2 sets. Pause the video if you need to, and then recheck. So those of you who may be doing a one-legged sit to stand, you're going to now, after you've done your 2 sets, go check out your motion again. Rescore it. 50 went to a 30. Maybe now it went to a 10. I'm trying to get you to 5 or less. If you get to 5 or less, you're done, okay? So let's just say you keep going until it plateaus. So that's what I want to say, from a 50 to a 30 to a 20. And I did it again and it stayed at 20. Okay, what do we do now? This is the cool part. Notice we went and did something not on the injured side. You go to most clinicians and chances are you yourself, culturally, we believe if you have right knee pain, you should go in, get treated on your right side somewhere in your leg. And you just witnessed how quickly going the opposite side can work. Well, that's a left-right opposite. Well, there's also a top-bottom opposite, and there's a diagonal opposite. Now, when it comes to the leg, top-bottom, you would think maybe it's the arm, but it can be something in the trunk that's holding you down. All we have to do is do a trunk motion now and see what it does to that knee. I will tell you, I like to start all my patients with rotations or side crunch, and I'll show you that in a second, no matter what issue they come in for. So, somebody comes with a wrist issue, I like to do a trunk motion. Somebody comes with a knee issue, I like to do a trunk motion. I like to make sure, though, when they test, they find something that's good and find something that's yucky. All right, so what I mean by that, you can put your hands on your chest, don't move your hands, it's not about arm, shoulder motion, it's about trunk. You're going to twist as far as you can. Then you can go this way. You're just looking, it doesn't have to be pain, it can just be restriction. It just feels harder, let's say. Okay, mine does. Let's say I'm going to call mine a 30. Over here, smooth as can be. Little more tight, smooth as can be. That's normal-ish. That isn't good. I'm going to be, it's kind of low, it's a 30. Now, if you want, I like to do a side crunch. A side lean or side bend means you're bending from here. I like to bend from your ribs. Notice how the difference is? All right, and I go, oh, that's smooth. Well, actually, this one's smoother. A little tighter here. Now, you might go, both of them feel good. Okay, if both of them feel good, that means we have something good. We have two good things to help fix that knee. But I say to you, if you had to do 1,000 this way versus 1,000 this way, which would you choose to do? That would be your gooder of your good sides. All right, so now what I'm going to do is I'm going to go to my good twist, and I'm going to do 2 sets of 20. Can't get to 20, do 15. Can't get 15, do 12 or 10. Okay, and do 2 sets of 20. All right, you're going to do 2 sets of 20. I'm going to do one set of something, okay? And then I'm going to show you what to do now. So 2 sets of 20. All right. Let's just say that's 20 for me. Let's say it's my second set. I'm going to recheck. I'm going to say my 30 went to a 10 on my twist. And now I'm going to recheck what it feels like to do, let's say this was bad. That was my 20, right? I'm going to go down and I say, ooh, that 20 is now a 10. Awesome. Do it again. Got it? Let's say it was your problematic one was a sit to stand. You're going to come up, you're going to do it again. And go, ooh, that's better too. Right? You got that? Now, you might say, well, which one do I do, the twist or the crunch? Test them both, see which one feels yummiest. Okay? And which one has the yuckiest and the yummiest, okay? Now, if you do this and you get to 5 or less, you get to be done. If you don't get to 5 or less, something easy to do is do a twist. Do an arm raise. All right, and check it, and you go, oh yeah, that's a little tight. Give it a score. Let's say I call it a 40. I'm going to do 2 sets of pushing into end range. So I lift up to the ceiling, I pull back. So I'm lifting my trunk and pulling back. Lifting my trunk, pulling back. Okay, lifting my trunk, pulling back, reaching to the ceiling, which lifts my trunk. Okay, so it's a whole body motion. I do 2 sets of 20. I recheck this. I say my 40 is now let's say it did really well. It went to a 0. Awesome. I'm going to recheck my trunk twist. And I go, ooh, that's good. Now I'm going to recheck the thing I'm trying to fix is my leg. And I'm going to score that. So that 10 went to a 0. Now this was, I don't know, let's say it went down to a 10. All right, and now it's all better. Now, gang, we don't like to do 3 areas of the body every session. We like to do 2 typically. 2 will get you typically pretty decent improvement. Now, for a home exercise, what you do 2 hours later, maybe an hour later, just test the problematic thing. All right, so let's say it was going up like this. Let's say it was just putting your socks on. All right, and now it doesn't hurt. An hour later, test it 2 more hours from now. And now it's starting to be tight. Well, you might say, I don't have time to treat it right now. So you go, okay, 2 hours later, is it tighter again? Sometimes the body is getting in positions that are helping it. And you'll notice 2 hours later, it's fine. Well, how does that work? Because the body's constantly trying to use good motions to fix you. Good positions, good feel-good things to fix you. Luckily, we do not like to hang out in painful positions. We like to hang out in comfort. That comfort is what is healing us. Okay, so from there, after you've done that, all right, 2 hours later, you may see it's getting tighter. 2 hours later, it's getting tighter. Okay, now you're like this. I'm getting tighter. If you don't choose to treat it, that's on you. All right? You see that the storm is coming, okay? The storm's coming. The storm of pain is coming. You're getting tighter and tighter and tighter. If you don't treat it, that's on you. But go ahead and treat it, and you go, I know how to get rid of that. Cool. Now, you might tomorrow wake up and go, oh, I'm worse. Because you will, after you fix yourself, use it so much more that you get yourself sore. Or some things start moving in your body, and places that weren't working are now having to work, and now you're more sore. That's okay. Same concept. Find out what motion makes you the sorest. Go to the other side. Oh, that feels good. Do it. You'll get rid of your soreness. Go ahead and do trunk. Legs, trunk, arms. Cool? All right, now, some of you who've had this less than 3 weeks will be, maybe this is all you need. If you don't have other things going on in your body, multiple issues going on, if you've only had it for 3 weeks, chances are you will be golden with this. You had it longer than 3 weeks, especially if you had it 3 months or more, you are going to need to know how to find deeper restrictions in your body. Okay, so we've got a systematic and methodical way to do that. Down below, you'll see 2 links, one for the general public, one for clinicians. Right? It teaches you how to find deeper restrictions. Then on top of that, you guys are going to run into things. We were all programmed that if my right knee hurts, somebody better do something on my right leg, whether it's me or whether it's a clinician. We weren't taught how to go to the left side or the top left shoulder or the right shoulder or the trunk to fix you. We've ignored the idea. If I asked you, how many of you believe the whole body's connected? You'll say yes, right? Yet, we have such a hard time understanding, wait a second, we haven't been trained this way. It's awkward at first, but eventually you're going to see it makes no sense just to stay in the area of injury. Okay? Because if the area of injury is not working, why would you stay there? Cool? Now, in those links, there's so much more treating that I show you. Like, in other words, I show you me treating other people, not just for knee pain, but for other ones. I show you why and how this works. And I show you some testimonials. And again, there's awesome packages ranging from very low priced to medium priced to get you mo better. Okay, so if you've had this at least 3 months and above, you definitely need to go and do it. Between 3 weeks and 3 months, what you just saw may help you. But again, life gets in the way sometimes, and you'll go into a position that's not one of these, and you'll flare it right back up and you'll say, it doesn't work. No, it does work. It's just that motion you just went into was a deeper level restriction that you hadn't found yet. Cool? All right. Till the next video.